Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy,
And my name is Sarah.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Oh, of course. I love putting Sarah on the spot. I mean, this is just the type of character that I am. But before we actually get into our episode and introduce our guest, we have a little bit of celebrating, Sarah. Not celebrating because of the W5 episode, but celebrating the fact that I think we're actually being heard. And we've hit number 2 again on Apple Medicine Podcast for all of
Woo!
Canada. So congrats to you, friend. That just goes to show that it's so important to lift not just our voices but the voices of others to ensure that other people are being heard, nurses are being heard. We will continue to talk about mental health issues, about women's rights, about racial equality and social justice. And you know what, number 2 is just the beginning. Again, we are always going to strive to make sure that our voices are heard, and hopefully we can get to number 1 at one point in time. What do you think?
Absolutely. I am actually crossing my fingers that we can get to number 1. I actually never thought we would even crack the top 10, and we have twice now, maybe 3 times. But this would be a huge accomplishment, and I can't imagine what else we're going to do
Yeah,
from
I
here.
mean, I all I have to say is, I'm very thankful for when the media reaches out to us to continue to amplify our voices. Like, I think it's just I'm just glad that people are starting to see the value in hearing from nurses and hearing from our perspective. So again, knock knock, Justin Trudeau, we're waiting to hear back from you. And of course, we would love to hear from people like Barack Obama, Michelle Obama, Kamala Harris. You know where I'm going with this, right? But anyways,
Sure
let's
do.
get into this really important topic. We have a great guest this week. He's a lawyer. Sarah's going to introduce him. And sometimes some people might be thinking, "Hey, why do you have a lawyer on?" Listen to this episode fully. You'll get to realize why we would have this gentleman on. So, Sarah, can you introduce our guest today?
Absolutely. And just to keeping in line with what we at the Gritty Nurse are all about, we're about hot topics, we're about pushing the envelope, we're about talking about the issues that no one else is talking about, and also just the intersection of health and law. I think people sometimes don't realize how closely they do intersect. And full disclosure, the guest we're going to have today is a friend of mine. So I'm going to introduce him. John is a litigator who handles cases big and small for a large variety of clients that range from international steel companies to individuals. His practice focuses on representing his clients before courts and tribunals for all kinds of civil, commercial, trade, and insurance matters. Central to his litigation practice is John's focus on service to others. Before becoming a lawyer, he served for 6 years in the Army Reserve. When he is not working hard for his clients, John volunteers his time for Pro Bono Ontario's hotline and the Consumer Defense Clinic. He also assists in coaching a team of high school students for the OJEN mock trial competition. Welcome, John. We're so glad to have you here today.
Thank you. I'm glad to be here. Congratulations, you two, on hitting number 2, by the way. It's
Thank
big
you, thank
news,
you.
huge news.
And we didn't know that. I didn't know that you were in the army. Oh, we didn't talk about that.
I actually totally forgot too. I'm sorry. I might have heard this in the past, but when I read that, I was like, whoa, I think I missed a whole part of your life story
Oh
here.
my God, Sarah.
Oh, goodness.
All right. So you mean
Yeah, go
I'm
ahead.
so glad that you're here today. I'm so glad that we're going to have this conversation. And there's a lot of hot topics out there pertaining to people's rights, human rights. We hear it all the time of people are the government's impinging on my rights, and they can't do this to me, and blah blah blah. And I think you know we can talk about it, but I think it's obviously better to hear from a lawyer, and that might give some better perspective, and it might help people who are listening to say, hey, this is how I might be able to think about it. And again, we always talk about like evidence based, or having the knowledge behind you to make an informed decision. So let's help our listeners make informed decisions today. So let's talk about the first question that I have. um, One of the first things is we'd like to talk about like the employer and them requiring you to get a vaccine. So could you maybe talk about, can your employer require you to get the vaccine?
Okay, that's a great loaded question to
Sorry.
start with. So no, it's great. The short answer is right now, no. Okay, so far, these are unprecedented times. So I don't want you to think I'm just like hedging on my answer. It's just true. We're sort of learning as we go here, and being lawyers, the legislature, the courts. So you just don't know what's going to happen next in some cases. I can tell you that it seems like unlikely politically that it will happen, and I'll get into why later. But so talking about it from the employment law perspective, you have your employment contract with your employer, and then you have your collective bargaining agreement, and neither of those requires you to get the vaccine.
Right.
Okay, and then the last thing is, if the government were to ever legislate the requirement to get a vaccine, you'd have to look at that from the Charter of Rights and Freedoms perspective. And it's tough to say which way the courts would go on that right now. So happy to take that and run with it if you like, but happy for another question if you
Actually,
like.
I think you should take it and run with it, because I think people are concerned that the government's gonna like strap them down into a black chair and stab a needle into their arm. And I can tell you right now, like that's not what's gonna happen. But maybe you can elaborate a
Of
little bit
course
more
not.
on the whole charter rights and freedoms aspect.
Of course. Yeah, sure. Okay, so let's talk about that analogy where the government ties you to a chair and jabs a
Right? Yeah.
vaccine in your arm. Um, so whenever you administer medication to somebody without their consent, there's a term for that. It's called assault. Okay,
Straight
and
up,
it's
right?
illegal in Canada.
It's
it
assault.
is it is assault. So you can't do that. The so no one's going to force you. There's a lot of words coming from the government right now about encouraging people to get the vaccine, but there's a lot of fear, right? A lot of people think, okay, they rolled this thing out in almost no time flat, less than a year. That's not how vaccines usually work. I'm afraid I don't know what the side effects are, the long-term effects are. And I think that's why the government itself is hedging on this, and that's why the law itself leaves some wiggle room here. So, Charter of Rights time, real quick. Basically, everyone thinks that you have these, indelible rights that just belong to you. And in Canada, it's not true. I don't mean to burst
Really?
anyone's bubble. It's true. You can't. Even section 1 of the charter actually makes it pretty clear that you
Right.
can't. It's actually kind of funny. So if you actually look at it, it actually says something to the effect of, these are your rights except, and it gives this
Right.
giant exception. I'm going to look at the language right here, and it's going to say subject to. So basically, it's subject to what you can do in a free and democratic society. So what the government is really saying, what the charter really says is, yeah, you have your rights, but we're also trying to have a civilization here. So if there's an important issue, or an issue that's important enough, we might actually go over
Right.
your rights. So if you're challenged, yeah, so that's exactly it. Yeah. So let's say you object to a vaccine, for example. Let's say it's against Section 7 of the Charter, which is freedom of religion and conscience, and you say, you know what, my God does not let me get vaccines. I do not believe in medical intervention. And what might happen, I'm not saying it will, is that you challenge that in the court, and the court goes, yeah, requiring you to get the vaccine really does infringe on your religious freedoms. But here's the thing. And then they go into this section 1
Right.
analysis, and then they say, but we really want to be over with this pandemic, and we really would like it if people didn't have to wear masks and we can all open and go to gyms again and all that. So you know what, John, we're going to make you get the vaccine. That's how the analysis goes. And the court's going to be a little more elegant than that, but that's the analysis in a
Yeah,
nutshell.
I mean, I think this is where like people in the last 4 years, I guess, of just kind of as Canadians watching what was unfolding in the politics in America, that people, some of those ideologies, not saying that they weren't here, because of course we know that there are people that think like some people in the States in terms of that whole very far right-wing propaganda type of thought, where they think that everything is impinging on their rights. Like, I remember even at the very beginning of the
Hmm.
pandemic, when they were like, I'm not going to wear a mask, that's impinging on my rights. Like, one of the things is, I think we have to boil it down to some like simple analogies, and I think you gave one, and I hope that maybe you'll bring that example. But it was like about, I think you were talking about smoking on a plane or something.
That's right, airline travel and stuff. Yeah. Yeah, exactly. So I mean, like, so for the airline example, I mean, you got to think about it. You can't smoke on a plane, and there's a reason for it. It's actually illegal. And then airline carriers, as like a common carrier, they have the ability to set rules. What you can and can't do. Just like there's laws against being naked on an airplane.
Right. I was
If you want to pick,
boo,
yeah.
wah, wah,
Hey,
wah. Can't be naked.
I know. Hey, we've all been real uncomfortable on an airplane. I mean, I think we've all
Oh
had that
god.
experience, but
And you're sharing the
but
seat. Like, come on. I just, okay, I have a really bad memory.
It's like, I need to know that
so
precedent
but
case. That sounds really interesting.
oh man, now I'm thinking of having to Google some nudist cases
Oh
when
my
this call
god.
is done. But the point is, the point is, you have to look at it this way. There is sort of a greater good going on here. You can't just do what you want, because some things affect the health and safety of other people. Just like how airline travel, for example, has been restricted since last year, requiring you to mask up in public areas, requiring you to, in some countries, not this one per se, in some countries, have a negative COVID test. When you land on the ground, and these things are being upheld around the world. So, the whole topic gets a little more flexible when you look at the larger goal of, let's all hopefully get over this pandemic someday, hopefully someday soon.
As the world begins to open up and restrictions are loosened, are there still things that are going to be upheld for COVID 19? So, for example, I heard an interview recently where they actually said Florida is not going to use the COVID 19 passport because they feel like it's infringing on their rights. But I kind of feel like it's the opposite. If you have gotten the vaccine, it's actually going to open up your rights again to be able to travel safely and, not put people at risk and not put yourself at risk. So, what are your thoughts about
Mhm.
restrictions and sort of opening up travel and things like that again?
Sure. So I mean, that's actually an excellent topic to look at, because it's different wherever you go. So for example, there's some things where it talks about privacy and individual privacy. In Ontario, we have something called the Personal Health Information Protection Act, which essentially says when you give health information for the sake of treatment, it then can't be used against you. So if you choose not to get the COVID vaccine, technically that information should be private. And do I think it's going to change? It actually might, depending on the severity. I mean, with the variants changing things almost daily, it could actually go that way. For now, the state of the law is basically that you wouldn't have to have a COVID sort of like passport, or like, let's say, a vaccination card to get access to things. It's not done yet, but I think there's some precedent for it right now. So if you have kids in school, for example, you'll know that they need to be immunized against certain things. But there is an exception to that, and that's kind of where I want to go with this. So you either have to have them immunized, or they have to have a medical reason not to be immunized, or you have to sign a form, which is essentially, well, I call it the conscientious objector form, but it's not quite called that. It's a statement as to
Right.
beliefs, and that's sort of it. And I think for COVID, I think it's probably going to end up being similar. You could be vaccinated, but you could also choose not to be vaccinated for, religious beliefs or whatever it happens to be. Or you might have a medical reason, respectfully, not to be vaccinated. I think it's actually that last category, though, that we sort of have to be a little more mindful of, because there are some people who maybe cannot just get a vaccine, or they may die if they do. And for that reason alone, I think our government may at least create an exception for them not to have a COVID passport or vaccine card. And for the conscientious objectors, I'm not sure what's going
Yeah,
to happen.
like, I mean, I agree with there. We have to have some form of some measure of flexibility, right? And I think for those who they have their religious beliefs or whatever the case may be. Of course, we're a democratic. We're not an autocratic society where we're just telling people what to do. I think we have to respect those rights. But again, I am fearful of those people who are like, yeah, it's my medical condition, and it's like, of course there'll be people that have
Mm-hmm.
medical conditions that, like you said, can't require them to have a vaccine because they could die. And then there are other people who are just
Mm-hmm.
like, walk to their doctor's office and is like, I'm not taking this, sign this note. And it's just like, I really hope, sorry for the terrible accent, but it's just,
I love your
but
voices.
it's just like, you know what I mean? It's just kind of like, well, like, how do we draw the line? And of course, I guess it's, there are some physicians that are going to be honest and be like, yeah, you actually don't have any. And then, there's gonna be some shady business. And I mean, I don't know how we can, like, I guess there's no real way around that, the fact that there's going to be a little bit from column A, a little bit from column B, but it's just, I think it's frightening to, again, have these conversations where people are not looking to science, not looking to, the voice of reason as to why we want to actually vaccinate our population. And again, they go speaking to how quickly it was done and all these various different things. But I urge people, like, do your homework. Like, don't just sit and watch, Fox News or or Rebel Media. Like, those are only telling you one side of the story and a very far right side of the story. Like, I think people have to listen to things that are in the center. Take the time to do your own research and say, okay, like, I've looked at some evidence-based articles, or reach out to someone else who might have that knowledge and expertise. But I think it's really scary to me that people will just blatantly say, no, I'm not going to do because I don't want to. And again, I think it just speaks to
Hmm.
the
Hmm.
whole, like,
Mhm.
we're doing this for the greater good. Like, I don't think there's any conspiracy or government control, or like, I turn my TV on and my eyes start getting those like little circles. Like, I don't think any of that's really happening, right? But realistically, people feel like there is some really crazy effed up stuff happening. But I don't. And I'm sorry, I just don't. And I think this is where I think people need a reality check. You need to do your homework. You need to see that the reason why we're vaccinating is because there's large amounts of death that we're seeing. We're seeing younger people in the ICUs right now. We're seeing the fact that even here in Ontario, our ICU capacity is becoming overwhelmed, and we're seeing 47-year-olds who have
Mhm.
had no previous health history or concerns in their health die of COVID-19. And it's scary. It's
Mhm.
scary AF. And I'm just kind of like, we need to kind of just make
Mhm.
sure that we're messaging this. But again,
Mhm.
yeah, like,
Oh,
sorry,
yeah.
one of the things you were talking about was like, the restrictions will likely be relaxed, but most likely they're going to be upheld. What about some of the stuff we're seeing in terms of, like, nurses outside of the work, even some physicians? Because Sarah and I used to get a
Mhm.
couple like really weird emails, and I'm like, I'm not responding to this dude. Like, I was like, he's like, have you read this like weird treatment? And I was like, no, I'm not injecting bleach into anybody's arm, so we're not
Oh my
going
god, no,
there.
I think the worst one we got was someone who was trying to get us to peddle silver nitrate or something as a
Oh
cure for
Yeah,
God.
COVID. And I was
Mhm.
like, I'm not even
yeah,
gonna go there. It's not worth my time. And we have a reputation to uphold, and our reputation is evidence-based
yeah,
facts,
Mhm.
science-based facts. So we just I mean, like, yes, you're welcome to have your opinion, and maybe we'll touch on this a bit, but when you're representing yourself as a regulated healthcare professional, we have an obligation and, a responsibility to be sharing accurate information, things that are not going against public health advice and recommendations. So I think definitely that's something we also want to touch on, right?
Yeah, no, I agree. So to take what you both said and go with that. So starting with the code of conduct, the nurses as a profession, you have this code of conduct, and if you go down to, I think it's section 6, there's things you can say outside of work. I think it's 6.4 or something like that. Nurses advocate for improving the quality of their practice setting to support safe patient care. Nothing wrong with going out in public outside of work and advocating for better
right,
care. Better what's better for the patients. And then when it comes down to evidence, I think Sarah and Amy were both saying this. You have to look at what's been done in the past, to know why people get in trouble for just having opinions on things without having them being informed opinions. Misinformation is the enemy, and if you look recently, I'm probably going to not say this name right, but I think it's Miss Hujanian and Miss Nagel,
mhm,
who were seen on the news recently, part of what is essentially an anti-mask protest. And at least Miss Nagel she was suspended without pay first. Then there was an investigation. Then she was terminated. And I think the college is investigating both of them. But I think where this falls is under that sort of section 6, which is about the public's opinion. Public confidence in the nursing
right,
profession. If nurses have opinions on things, and this is sort of like the legal take on it, it must be based on evidence. And I'll tell you that you get a lot of this based on two old cases. One is the Sault Ste. Marie Hospital, and the other one is St. Mike's Hospital, and they're opposing vaccine or mask policies. And that's not to say nurses were being anti-maskers, far from it. But what we're looking at is there was actually nurses challenging a certain work policy, but they put a mountain of evidence before the labor arbitrator, and it's based on research journals, doctors who actually look into this stuff, talking about the flu, how it transmits, information from the WHO, information from the CDC. Like there's not enough time to list all the evidence they had, but and that was the point. The ONA was actually taking a scientific approach to challenging a specific work policy. It wasn't just saying, yeah, we don't feel like following this regulation. It was, no, we're healthcare providers, we're professionals, we believe in science, but the science also has to match with the policy we're following. And I think on the other end of that is someone who wants to attend an anti-mask rally because they somehow think masks are not good for people or something. It's completely devoid of all the evidence and all the science that the nurses stand for, and all the goodwill that you've built over the years.
Everything you said is like it rings true. It is exactly how it's supposed to be. But I tell you, John, nurses are terrified of speaking to the media. They're terrified of speaking out. And again, we only hear, or primarily hear, I shouldn't say only hear, we primarily hear from figureheads. So it might be like a president of this nursing association
Mm-hmm.
or president from this nursing association. But it's very few and far between that we actually hear from, like frontline staff or a nurse who just of her own
Mm-hmm.
volition is like, F this crap. I need to say what I'm seeing in the interest of, like you said, the greater good, the public, and advocating using evidence based research. It's just like me and Sarah, it's been like pulling teeth. I'm like, okay, we know some great nurses out there, some great nurse advocates, some great patient advocates. And we're like, hey, come on our podcast. And like, no. And I was just like, uh, yeah, I guess it's not no, it's just like no response.
No, it's actually kind of crazy, John. So I have been in a group chat of 50 nurses, okay, 50 of my former colleagues, and I asked this question. And you can see on Facebook when people have read the comment, right? Because their little picture moves down. And I'm like, everybody read it? Nothing. Nothing. And I kind of like Amy and I have been doing a lot of this, and it's not because we don't want to share the attention, it's because everyone is afraid. And I just kind of wanted your take on it. So if we're not violating PHIPAA, so we're not sharing confidential information, and we're not saying anything negative about our place of employment. Are we allowed to speak out? Can we have a blog, a podcast? Like, is that going to quote unquote get us in trouble?
So it shouldn't. Nurses, just like every other person, enjoys the right of freedom of speech and expression. We have that right in Canada. And when it comes to what are the bounds of that freedom of speech, well, you have your code of conduct, and then you have employment contracts that may prevent you from doing certain things. But within the bounds of those, fire away. As long as you're not, doing something that's crazy and not evidence based or not science based, then there should be literally no problem with it. It's I think usually if you hear the stories of somebody who was fired for speaking out about bad policies or something, usually there's a little more to the story. And I'm not saying the news is getting it completely wrong. I'm just going to tell you there's always some facts missing. There's got to be something else to it. Because somebody advocating for better healthcare, as a member of a healthcare profession, there's literally no punishment for that in your code of conduct. And like I've never seen an employment contract that would punish that.
That's so interesting, right? Because like the first thing that we always hear is, "Oh, did you hear that story of this nurse that got fired? Did you hear that?" I'm like, "What's the nurse's name? Like, who is this person that got fired?" So I mean, so yeah, it was that nurse of the other nurse of that nurse, and they're like, "What nurse are you talking about? Can you give us a name? Like, can you tell us?" And it's like, it's a ghost story, right? It's like, you know what I mean?
It's
It's an
like an
urban
urban
legend. It's a
legend.
ghost story. It's like this, 1,000 years ago, this nurse said this thing and she got fired. And we're like, well, can you, like, what's the name of the nurse? Can you tell us the name of the nurse? Then we'll search her up. Like, we have find a nurse in Ontario. We can find her. Nobody knows who this nurse is that has been fired for speaking out about like health, like improving health outcomes. So I feel, to me, it's like, if we were doing like Mythbusters, I know they don't have that show anymore, but it's like you'd be like,
Right?
myth busted. Like there is
Busted.
no nurse that
Yeah.
I know of that I have been able to find that has been fired for speaking out about better health outcomes, improving healthcare, being transparent, not using any confidential information, not speaking on their behalf. I don't know
Mhm.
about it, so I have to say myth has been busted.
Yeah, I'd say so. Especially, all the like public discipline positions or public discipline decisions of the college. you can find them online, and there just isn't one like that. Most of the decisions, it's someone who, let's say, failed to tend to a patient properly. It's not went on Facebook and totally said these things that totally didn't make sense, and the college happened to disagree. There are some limits, by the way, about Facebook, and I've come across this with another profession. I can't tell you which one, and but basically somebody was using Twitter, and using their position as part of that profession. I'll make it up. I'll say they were a lawyer, and they were saying, "I'm a lawyer, and it's my
Oh
opinion
God.
that." And then they would give this, then they gave an opinion that was defamatory. They were, lying about somebody's integrity and mental state and their fitness to engage in their job. And you can't do that because it's
Right.
defamation. But it's not because you're a
Exactly.
nurse. It's because you're a person. You're a citizen. Nobody can
Right.
do that. you know you know it's the hard part about this in the professions too, and no exception for nurses. You're supposed to be
Right.
model citizens, and your college won't let you forget it. And there's a good reason for it. It's public
Right.
confidence.
And I mean, I think this is
Hmm.
where I think people have to understand too. Public confidence doesn't necessarily mean that I can't swear on my podcast. Like I think that's the other thing that like came up at one point in time. It's like, yeah, no, I have the right to say that. I can swear. I could do whatever I want in terms of, how I'm speaking. And I think that was always kind of like, I think for me when that actually came up, I had to laugh it off. I was just like, oh my gosh, like, I'm not asking you what you do in your house in your privacy, but like, I mean, I think it was just such a bizarre thing that kind of came up. But again, like I actually had a thought where there was a nurse who was disciplined for social media. And again, this is where I think you would say like this is what was different. And it was actually a case in the States. And now she actually does have a podcast. Why am I drawing a blank at her name? Oh, her name is Katie Duke. And I think she was like an
Right.
Yes.
ED nurse. She was on some like ED reality TV show type thing.
Something with
Yeah,
Dr. Oz.
it was
Yeah.
bizarre. Anyhow, I think what she had done was she had taken a picture of an aftermath of a patient who was hit by a train in New York, and she took a picture of the aftermath of the room, I guess, that they did resuscitation and all that stuff. And of course, I think she tweeted it out or whatever, Instagram, whatever platform she used. And then it was just like her employer called her up, was like, "Yeah, you're fired." And it's like, yeah, that might be
Yeah.
drawing the line a little bit. And I think people just have to know like that's unacceptable, right? But like even now she's got her own podcast. I think she's seems to do quite well for herself. But I think like that's where you have to understand like where that is different from just saying, "Hey, I'm seeing a lot of death in my ICU."
Well, I think also the problem with that picture, I think that's breaking, privacy laws because based on how that room looks, people might be able to tell what hospital that was and draw conclusions as to what happened to that patient. Like, it was left a mess. Does that mean they weren't following infection control? Does that mean the patient didn't make it? Like, I think there's a lot of issues when you're speaking about something specific like a hospital versus, you're advocating for sick days, better mental health supports, the fact that
Right.
nurses needed PPE earlier in the pandemic, that's totally different. So I think people need to understand that. And John, I'm so glad that you said that we can speak out because I think a lot of our listeners, a lot of nurses just need to hear it from someone else that's completely out of our industry, and especially someone that's a lawyer.
And someone with no skin in the game. No, that came out wrong.
No, 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 no. I get it. Like I get it. I think you're right. Yeah.
It's no, but it's true. It's like you absolutely have the right. There's like joining the profession is not the same thing as agreeing to be muzzled over certain issues. In fact, you are in some ways the best advocates for certain issues, and it's just really about that. Just like a lot of lawyers, a lot of them go on the record talking about reform of the court systems. Well, we actually use the courts quite a bit. You'd almost think we'd have an opinion on it.
Right.
So nurses no
I'm
different.
going to give you the biggest post-pandemic hug after I get my second dose and we've
Aw.
relaxed and we've
I know,
relaxed some
right?
of these measures, because honestly I think that is so important for nurses to hear, and even not just nurses, like physicians get it too. Like there was that physician, I think he was out of
Mhm.
William Moser, and they like canned him, but then
Mhm.
the Ontario Medical Association stood behind him, which I thought, I was just like, thank God that at least they've
Mhm.
stuck together, and they recognize that, hey, one of us is down, let's all protect this person. And he got his job back. But like I have to say, and I know this, it sucks, and I know some people might be hating on me, I don't feel we would have had the same response if a nurse was being attacked like for example, if it's Sarah and myself, we were attacked or we were fired or whatever for doing the work that we were doing, I don't know if we'd have people rallying behind us. I hope we would.
I'd like to think we would, but I just feel like there's this double standard, you know? There's a double standard with what happens to a doctor versus what happens to a nurse when it's the same or
Mm,
similar situation, I feel like. Because how many doctors do you know that go to the media and aren't able or don't feel comfortable sharing what hospital they work at? And how many nurses feel comfortable sharing the organization?
Yeah, well, see, that's not a physician problem. That's like a nursing problem.
Right, right.
I'm glad that they are hearing it from a lawyer to say, you know what? Yeah, you're not like, I mean, it's okay to have these conversations and to speak up.
it is, and as long as you also bear the responsibility of your profession, people are going to know you're a nurse, and you gotta, pardon the phrase, but you gotta represent because you are representing. You do.
I like it. No, no, no. I like it. I like it. That's what Sarah and I try and do, always trying to represent. One of the other things that we kind of want to talk about, and I feel like I'm diverging because this was actually some really great conversation, is maybe some even interesting healthcare cases. Could you maybe just tell us maybe one or two really interesting healthcare cases that you've come across in your practice and how that might relate to healthcare?
Sure. So, I mean, okay, so there's a few, there's one it's not quite healthcare, but it actually kind of ties into something we talked about a little while ago. So, with
Hmm.
these lockdown provisions coming in, there are, we talked about freedom of religion and freedom of conscience, and the lockdown provisions have been challenged by at least one church. Okay. And it was limiting their
Right.
gatherings. And what they said was, well, we got to be able to worship in person. And I got to tell you, the court didn't agree. They did say
Hmm.
absolutely infringes on your charter rights, but we really want this pandemic to be over with someday. So for
Right.
now, they can worship remotely. It's and that's a recent one too.
Well, see, I thought I just read something just like maybe 2, 3 days ago that there's like a church. Oh my God, where is it? I can't remember. Somewhere in Ontario. I feel like it's Bradford, but don't quote me. That's probably not where it was. But there's some church where this one pastor's blatantly defying, I guess, the provincial guidelines
Mhm.
and is having in like person services. He's an anti-masker,
Mhm.
and like, what happens in those cases? Like, we hear about it and we're like, well, is that person like just getting away with it? Like, we have these
Yeah.
public health guidelines. This person's like, no, you're impinging on my religious freedoms, and we've seen them in the media. But it's like, well, what happens with them? Is it just like, okay, that guy gets to do it? So, for example, like that other nurse who came from Pearson was like, well, what are you guys gonna do to me? You can't do anything. Like, what happens in those cases?
Well, in theory, they're supposed to be fined, and I don't mean like in theory. I mean that's what the law says. Just they could be fined for doing it. Just like, for example, if you don't have your kids immunized for school, you can actually be fined up to $1,000. There's a law that
Right.
says that. So that's in theory what's supposed to be happening. I know there's been some hesitance on the enforcement and some hesitance on the guidelines being as strict. Part of the government's policy, as I understand it, was to educate instead of just punish, because they're trying to figure, well, we have people losing their jobs and we don't want to also hit them on the other end because they forgot to wear a mask once. But in theory, there is a punishment for this, and it's a fine.
Right.
So to answer your question, no, are they getting away with it? I don't think so. There's a good case out in Etobicoke, close to where I live, about a place called Adamson Barbecue. That's
Yeah, yeah, we've heard
Ah, I
about
remember
that.
that. What's
yeah,
happening
that's
there?
I'm positive he was taken away in handcuffs at some point. Don't quote me on that, but it was a big deal, and I'm positive to the restaurateur. I mean this respectfully. I'm positive it was a publicity stunt to raise awareness about the issue that
Right.
restaurants, were suffering because of these lockdown measures. And but the thing is, there was an actual fine. Can't imagine going to jail. Yeah.
Right. So just to give our listeners some context, this was a restaurant that opened up defying public health measures when we were on strict lockdown to not operate. And so they opened, and they were shut down by the police. The next day they reopened again, tweeted about it, posted on social media. People were showing up, and then the police had to come shut them down a second time. I think it might have happened even a third time, but it was just ridiculous. Like I think he started a GoFundMe and actually raised a lot of money,
Yeah, it's
which is kind of scary.
it really makes you wonder. But I think what we're seeing here, because I want my faith in humanity still, is that I
Yeah, I was
think
gonna say, oh God.
I think we sort of see like it's a sort of like a collective suffering point of view, instead of saying he was legally right, because he wasn't. He was in violation of strict guidelines, and there's no two ways about that. You're hearing that from a lawyer. Okay, the guidelines are relatively clear, and when the law's clear and you can follow it, you have to. There's no exceptions.
Right. But it's so scary, right? Like, I mean, I think for us in the nursing community, that one particular nurse, that kind of hit us where we live, right? We're nurses. We again have to abide by evidence-based practice, at least if we're representing ourselves as a nurse, that, whatever is coming out of her mouth, it does support scientific evidence. And this nurse just like, I mean, I think she pretty much went viral. And I think actually I've now seen her at anti-protests. I don't even want to mention the name because I don't want to even give them any more fire,
Right.
but it's just like we're just kind of so shocked. How is it that, we haven't heard from the College of Nurses in terms of the discipline. We're not getting that closed loop in terms of like what's happening. And I think again that just bleeds into where people are feeling mistrustful and saying, "Hey, well, nothing's going to happen." Like I agree. The law is the law, and you can be punished to the extreme based on that law. But again, if we're seeing or we're not getting that closed loop, it's disheartening for us at least.
Yeah, what I will say for some of the college complaints is it takes time, and the college's process, like a lot of professional organizations, the investigation is private. Like so maybe the news will report that yes, this person, let's say Miss Nagel, for example, who we discussed earlier, is under investigation. But as the public, we're not allowed to know what the bounds of that investigation are. And the part of that's out of
Right.
respect for the member, and then part of that's really to respect the integrity of the investigation. You don't want anyone tampering with evidence or getting to witnesses beforehand. You want to
Mhm.
find out what's going on. So the process does take time, but once it goes, I've seen colleges act on bad behavior, and that's just not nurses. That's doctors, lawyers, dentists. They do pounce when there is a case to be made. And if not, well, the investigation gets dropped. But hopefully there'll be a closed loop on some of the stuff. It just takes time.
Well, that's a good perspective because,
Mhm.
like, even me, like, I guess it's just, you want to see change happen. You want to see it now, right? And it's just especially when we saw that there are almost 4,000 deaths in long term care, and
Mm-hmm.
that this nurse worked in long term care. We're all like, just nauseated at the fact that this person's going to go back to work and work with these people. And of course, we want the answer now, but I can appreciate, and it gives me even more understanding in terms of the process, knowing that these things take time, and and like you said, the respect of the private of the person and those things. And
Mm-hmm.
at least I could take that back as learning for me in terms of that. I guess it's like, let me speak to my ed. I'm saying it's not going to happen right now, but the work is underway. I think there is a case May 26th about a labor arbitration case where nurses could not come into work, long-term care, if they were given paid leave.
Yeah, that's the selection of long-term care houses, long-term care homes, and the ONA case. I have read that one actually. Basically, this is one unfortunate one. So last year, at the time, the collective bargaining agreement that operated on that one, so nurses who were not coming in specifically, not just because they had COVID or tested positive, but because they were afraid they would test positive for COVID, or because they had traveled and they're following other guidelines. So what the ONA was pushing for was to try and get paid leave for these nurses. The arbitrator didn't side with
Mhm.
the ONA in this case, but it was because it wasn't part of the collective bargaining agreement. Yeah, well, the silver lining though is that there was an amendment to the collective bargaining agreement, I think January this year, and I'm talking about the general one for hospitals. There's lots of
Okay.
local ones. I haven't read all of them. I've read the main one for the hospitals here. It's 117 pages, not exactly a page turner. But the
Yeah,
point is,
I was gonna say it's probably not, and maybe a nighttime read just before you want to go to bed to fall asleep.
yeah, but the point is that one is up in June of this year as well, and there's still the union and I guess the rest of the collective, they're still trying to figure out what to do with COVID, because this issue is so novel, and this is out of the utmost respect for the bargaining process. The issue is novel. It's hard to figure out what is actually needed. So maybe it is more mental health days. Maybe it is paid leave, like they were asking for in that case, but couldn't get because it wasn't part of the agreement. It's sort of a process, and it's sort of like the same lesson as with the college. These things take time, and the law doesn't change just because we want it to. So that's the hardest part about, like, this my job, is people feel like there should be a result, that things should land a certain way, and emotionally, they got a point. It's just that legally, not always. And that's the hardest part. You have to tell somebody,
Mhm.
I'm not there to invent new laws. Very rarely can you. And we're going through this pandemic, and you're going to see cases come up as they go. Just to give you like a similar case in point, there's the union out of Woodstock, CLAC Local 303, had a case for the Crescent Care Nursing and Retirement Home, and basically they didn't know if they had to submit to mandatory biweekly COVID-19 testing, and it was a nasal swab. And a lot of them were saying, "Well, this is really uncomfortable. I don't want to get that thing shoved up my nose." Having personally gone through it 3 times, it is not my favorite feeling. It just isn't.
Oh, no.
Like it is.
I don't think it's anybody's favorite feeling.
It's like, can you please just slap me in the face next time? I'd prefer that. But no, but seriously. So that was the question submitted to the arbitrator, and what the arbitrator did was, yeah, they are going to uphold the surveillance, but there's medical accommodations available on a case by case basis, and if you don't want to do the nasal test, there's actually a throat swab you can do instead. I hadn't heard about rapid testing. So the point is, we're on the cutting edge here. Things are still changing, and people, labor arbitrators, judges, lawyers, nurses, doctors, everyone's adapting as fast as they can. But legally, the whole process is necessarily slow. When you challenge a work policy, there are like criteria to look at. Okay, well, are the criteria clear? Is it consistent with the collective agreement? Is there something that they did to bring it to the attention of the employees? And there's other factors, but they look at all this stuff and they try to think, okay, what's the balance? What's better for everybody? Who's right? Who's wrong sometimes?
This episode was packed with great information.
Wow.
Like, I mean, I can't imagine anybody
was
walking
so
away
informative.
like having not learned something today. Like, I'm just like, I feel empowered. Thank you, John.
Oh, well, thank you.
But it's just like, it's so important to have these types of conversations and have people who have, a little bit of a different perspective than myself and Sarah. Like we don't have all of the answers, and we have to seek out and reach out to people who might have a different perspective and have a way better way of explaining it than maybe we could. So very thankful to have you on, John.
Well, I'm grateful to be here.
So John, before we wrap up, any last other words?
So when we're looking at, going forward, COVID-19 policies, like at the workplace for healthcare workers, for everybody else, it's really sort of a better safe than sorry approach for a lot of workplace policies. And as arbitrators and judges get into this, they're always looking for ways to accommodate employees to mitigate sort of like the invasiveness of, let's say, testing or whether someone's been vaccinated. But right now, the policy really is like pro-mask, pro-vaccine. And it's going to be that way until this is over. I'm calling it right now. It's going to keep happening, but they're always looking for ways to accommodate.
Thank you so much, John. And I really like how you explain things in a way that, we can understand, because I sort of imagine when people that aren't in the medical field are reading research articles from medical journals, they're probably just as lost as I am when I'm reading things that are legal. And I'm like, I'm already losing my train of thought. But yeah, just wanted to thank you for coming on, and we really appreciate all the knowledge you've shared. Did you want to share with our listeners how they can find you, or anything about your practice?
Yeah, just real quick. One of the parts I pride myself on is I'm almost always, available for discussing issues. I would much rather talk to people and see if I even can help them before I say, okay, that'll be $1,000 up front. I'm not that kind of guy. If people do want to find me, it's www.jhrlaw.ca, real easy, or my email is john@jhrlaw.ca. I have a lot of knowledge about a lot of different areas of law, and honestly, we're just out to try to make the world a better place, I guess. So with this podcast, I hope you guys keep going, and I hope you hit #1 soon. And honestly, I was honored to be here. Thank you so much.
Thank you so much for coming on. It was a pleasure.
Thanks.